turned out to be incorrect, excuse me, because they were all believing that that line was going to continue to keep going up. What happened is New Yorkers, Americans, changed reality, literally changed reality. They literally changed the path of the virus spread and reversed the spread, and that's what the closed-down procedures did. That's what the masks have done. That's what the socially distancing has done. And New Yorkers and all across this country, you saw that number change from that up trajectory to the downward trajectory. That shift in the trajectory reduced by about 100,000 the number of New Yorkers who would have been hospitalized. 100,000 hospitalized. To be hospitalized, you have to be seriously ill. A portion of those 100,000 would have passed away. So all this inconvenience, all this turmoil, for what? To keep 100,000 people out of hospitals. That's for what? And the 100,000 people into hospitals would have overwhelmed the hospital system, would have been chaotic. That's where Italy was. And a number of those 100,000 would have died. So remember that context. And not just for the retrospective, but for the prospective. Our past actions changed the past trajectory. Our present actions will determine the future trajectory. It is that clear. It is cause and effect. You tell me what we do today, I will tell you the number of people sick tomorrow. So every day we get up, every day everyone says, oh my gosh, I have to do this again. Yes, but what you do today is going to determine the number of sick tomorrow. And New Yorkers have continued to do what they have to do, and you see that number of hospitalizations dropping. And that is all good news. And that is a credit to the community and the social conscience and the responsibility of New Yorkers. The question now is, as we're on the decline, how fast is the decline and how far is the decline? How low will the number actually wind up? Right now, we're at about 1,000 new cases per day, okay, in the 900s. 954, 933, 970, 973. That's 4 days. The day before that, it was 1,076. That looks like the number is flattening, is plateauing at about 900, 1,000 cases. 3, 4 days, 5 days, if you want to say, between 900 and 1,100. That is still too high a number of new cases to have every day. It's not where we were. It's a lot better than where we were, for sure. But 1,000 new cases every day is still a very high infection rate. It's still a burden on the hospital system. So we now want to take it to the next level. Let's drill down on those 1,000 new cases. Where are they coming from? Why is the infection rate continuing? Who's getting infected? And let's get more targeted in our response, right? We're fighting this statewide, but you have to wage the battle, wage the war on many fronts. It's a statewide battle. Now that we have it basically stabilized and on the decline, the enemy is on the run, the virus is reducing. Let's get more refined, more targeted. And I'm going to be speaking with the hospitals this afternoon and say that we want to get more specific information on those new cases that are coming in the door. Where are they coming from? Who are they? To see if we can come up with a more specific target. If you look at the past few days where the cases have been coming from, this is a 3-day, what they call rolling average. But you see, 17% from Manhattan. Much of it correlates to population, but much of it also correlates with downstate New York. 17% Manhattan, 17% Kings, 12% Bronx, 11% Queens, but then 10% Nassau, 7% Westchester, Suffolk. So it's a downstate region, and then upstate, it's Erie County. So gives you a snapshot of where the cases are coming from, but we need more specific information to have a specific battle plan. Literally, where do the new cases come from? Are they essential workers? Are they people who are staying home and getting infected by a family member? Or are they essential workers who are still traveling and possibly getting infected at work? Where do they work? How do they commute? Is this a question of getting infected on public transportation? We just announced new subway buses, Long Island Railroad, Metro North, protocols. Where in the state are these people who are being transferred from a nursing home? What's their sex? What's their age? What's their previous health status? What are the demographics? Let's get more specific information from the hospitals to see if we can come up with a strategy that is more tailored to the reduction of these 1,000 cases per day. The number of deaths, 289, lower than it has been, but still tragic and terrible. And all the good numbers, all the good news, for me, every day, this number just wipes that all away. We announced a statewide policy for our schools. We did it last March 18th. We said that we were going to close schools all across the state, K-12 and higher education schools. We waived what was called the 180-day requirement, which was a state regulation that schools had to have 180 days of teaching. Schools then transferred to distance learning programs, meal delivery services, child care options for essential workers. That has actually worked out well, not perfectly. We had to do it in a rush, but there are lessons that we can learn here that could change teaching going forward and teaching in these types of situations going forward. But it did work